Hi everyone, welcome back to my channel. So for those new here, hi, my name is Jenny. I am a family medicine physician and a mom of two. And with the current pandemic, everyone wearing masks, I don't think that masks are going away anytime soon. With mask wearing all the time, we as people have been suffering a lot from maskne. So today I wanted to tell you guys what I've been doing to try to combat this. So if you guys are interested, then keep on watching. So first off, I just want to say thank you as a family medicine physician, as a healthcare worker, a frontline provider, that you wearing your mask has been so helpful in decreasing the healthcare burden. Also, not only does it protect yourself, but it protects your neighbors. So continue wearing your mask and socially distant because we appreciate it and the world is depending on us. All right, so second, I usually wear my mask all day long, and so I try to breathe through my nose while I am wearing my mask. And the reason why is because when I breathe through my mouth, there's a lot more condensation that gets trapped behind the mask. My body tends to sweat more in this region, and then I break out a lot, like in this chin area and even along the sides right here. And so I try to consciously breathe through my nose. If you find that you're sweating a lot under your mask, I would recommend dabbing off that excess sweat throughout the day, just because leaving that sweat on there can clog your pores. All right, so let's move on to my skincare routine. So every night I like to thoroughly cleanse my face just to get rid of any of the dirt, any of the sweat, any of the dead skin cells that have been on there that can possibly be trapped and then cause acne that way. And so what I like to use and what I actually recommend for my patients when they come in with just regular acne is a benzoyl peroxide wash. I had this since med school, and so you can see it's like completely empty. So most recently I moved over to this Neutrogena. It's also a benzoyl peroxide wash, except it's branded now. I don't recommend any single brand, but the benzoyl peroxide is the active ingredient that you're looking for. So this specifically has 10%, and it also has some zinc in it, which can fight against acne as well. I would recommend that if you have drier skin, try to find the lowest benzoyl peroxide you can find, usually from 5 to 10%, and you can do that face wash that way. Afterwards, I like to put on a moisturizer, as I said, because it can be very drying, and I usually use the Nivea. This is the Soft Face Body and Hands Moisturizing Cream. So remember that anything in a container like this that you scoop out will be more moisturizing than anything that you pump out of a bottle. So the thicker it is, the more moisturizing it is. So I do that, and then I move on to a tretinoin gel, and this is a prescription that you can ask your doctor for acne. It's not recommended in pregnancy, but it is safe during breastfeeding. If you don't have a doctor, there is luckily something very similar, just a little bit less strength, over the counter, and it's called Differin gel, and you would just put this on every day. It's a vitamin A derivative, and what that does is that it helps turn over your cells more quickly than usual. So a common side effect is that if you have acne that is in your skin already, that's brewing, it is gonna bring it out faster. And so people are gonna be like, oh, this made me break out, but actually it's like it was in your skin already and it was gonna come out eventually. This just made it come out faster. So try to persist. It takes a couple weeks, and then your skin feels a lot newer because of the new skin cell turnover. It also has an added benefit of reducing fine lines and wrinkles. If you are unable to get a tretinoin or a retinoid cream, or you don't want to use Differin gel, another similar product is called retinol, and this one is by Naturium. So basically this does the same thing, except the strength is not as strong. You don't get as much of the drying side effects of it, and I don't think anyone is better. It's just whichever one that you use. This one is very expensive. Well, actually this itself is not that expensive, because I think this one was like $25. I'll have to check, but I'll put everything that I talk about today in the description box. This is prescription, so if you ask your doctor, usually insurance will cover it for you. And so I use this because it's free. So on alternating days, I can also use this benzoyl peroxide cream, and I'll just put it on the areas where I feel I'm breaking out. So in this region here, I usually have breakouts, in this lesion here, and then over here, I usually have breakouts. So I'll concentrate it in those lesions, but I don't use this a lot because I find that this is very drying on my skin. But I do use it because occasionally I'll have to use an antibiotic such as clindamycin or something like that, and you don't want to use an antibiotic, clindamycin, by itself. You want to use it with benzoyl peroxide to prevent resistance. So we try to do different things, right, to prevent clogging the pores, which is like wiping off the sweat, not wearing makeup. Secondly, we'll try to increase cell turnover. That's with the tretinoin. And then now I'm talking about more of an exfoliant. So I'm talking about things like salicylic acid, lactic acid, glycolic acid. So I use this malodelic acid, topical acid. I don't know. I can't read, guys. So I use this, and on days that I do the spot treatment with the benzoyl peroxide cream, then I'll use this. All these things, I want to warn you that they're really drying on the skin, so I would not use them all at the same time or all together. Oh, warning, this benzoyl peroxide can stain your clothes. So if you are wearing this and it's like has any color, it will stain it like white. So during the day, try to wear as minimal makeup as you can. I am still trying to get rid of old like acne scars. I have really bad post-inflammatory hyperpigmentation, and that is just from like acne where it would go away, but like the scar is still there. So that's what we call it. And so what I do for that is I use a vitamin C serum in the morning. It's an antioxidant, so it helps with that. Then I put on the same moisturizer as before, and then I would put on a sunblock. I will always wear sunblock, even if I am staying inside, because the rays come through the windows and can still damage your skin. As I said, I have really bad hyperpigmentation problems, and so I would always wear sunblock. I've been loving this. It's from Elta MD, and it is a sunblock and moisturizer that is SPF 44, and it protects you from both UVA and UVB, and it also has zinc oxide in here and hyaluronic acid in here. It's tinted, so I will show you by just putting this on the top half of my face, since I go to work and you can only see the top half of my face anyways. If you don't want a tint, I use the Elta MD Skincare UV Clear, and it's broad spectrum SPF 46. And this also helps from acne prone skin. So I will put this at the bottom so you can see. But yeah, I think that it's the tinted one that gives me that glow, and that's all that I do. And then I'll do my brows, and basically that is it. I put on my mask for work and wear it for the rest of the day. So being a family medicine doctor and my passion in preventative medicine, I cannot leave this video without telling you guys that the skin is the biggest organ in your whole body, and it is a reflection of your health overall and how it is on the inside. And so if you are experiencing breakouts and acne, there is something that your skin is trying to tell you. So not only genetics, but there are a lot of things that we do control, such as diet, exercise, and our overall health that contributes to how our skin looks. So some things that make your skin worse and break out are foods that are high in carbs, such as rice, breads, pastas. I'm not saying eliminate all these things. I'm saying everything in moderation. Other things are whey protein, simple sugars. I remember at the start of the pandemic, I was working as a resident and my skin broke out so bad. But then again, I was binge eating chocolate every day. Like I was like, oh, this office has a piece of chocolate, and oh, this person has a piece of chocolate. I'm just gonna grab all these pieces of chocolate because I was stressed out. That being said, stress also makes you break out more. And so things that I personally do to try to combat this is every morning I've been trying to do some yoga, do some exercise, get my body moving, get my mind in the right place. Also, I've switched my lunches to being all vegetarian. I try to eat all my veggies during lunchtime. So I'm trying to transition my kids and my husband to a more veggie friendly diet, but they love their meats. And so I try to get all my veggies in while I still can during my lunchtime. Other foods that are high in antioxidants that can actually help you reduce that acne flare are berries, avocado, things that are high in omega-3s such as fish and salmon. Those leafy greens, those are high in antioxidants. So if you can, try to choose those fresh foods to feed your body. As I said, stress is also a contributing factor of why people break out. And so ways to manage stress, meditation, it's very hard for me. Like, I'm still trying to get a hang of it. Talking to supportive people, taking breaks from social media and the news. It's okay to turn things off sometimes. And taking just time for yourself and doing things that you enjoy. Because we as people always try to go, 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 and we never stop. Also, if you're anxious all the time, you have that increased cortisol all the time. And so a way to help you during times when you feel like your heart is racing too fast and you feel a little bit short of breath and you feel like an anxiety attack coming on, focus on your breathing. And you can either breathe in a square, like breathe in 1, 2, 3, 4, 5, hold 1, 2, 3, 4, 5, and out 1, 2, 3, 4, 5. In 1, 2, 3, 4, 5, hold 1, 2, 3, 4, 5. Get it? So you like breathe in a square. Another option is what I call the 5, 7, 8 breathing, where you breathe in 1, 2, 3, 4, 5, hold it for 7, 1, 2, 3, 4, 5, 6, 7, and blow it out for 8. 1, 2, 3, 4, 5, 6, 7, 8. And I would usually do that anywhere from 2 to 5 minutes when I feel like I'm getting an anxiety attack, or like the other day I was driving to work and like if for no known reason my heart started beating really fast, my hands started to shake, and I was like sweating, and I'm just like, I don't know why I'm feeling this way, but I know that this is the feelings of anxiety. So I started focusing on my breathing and I did the 5, 7, and 8 breathing, and then it went away. So yeah, that is how I fight against maskne and maybe acne overall in general. I hope you guys enjoyed this video. Let me know if you guys have any questions in the comment section below. I love getting to know you guys in the comment section. Next week I am going to talk about my Botox experience. I did it because I was getting extreme headaches and I was grinding my teeth, but also it slimmed my face. So if you guys have any questions about that, I can address in next week's video as well. As always, thank you guys so much for watching. If you haven't already, please subscribe, and I'll see you guys next week. Peace.